In terms of risk factors for prostate cancer, it really is multifactorial. So there's numerous factors that actually may increase the incidence of prostate cancer in men. There's three kind of basic ones, or probably the most reliable risk factors, and one of them is advancing age. So the older a man is, certainly the risk of prostate cancer also increases. The other one is family history. So if there's more than 2 first-degree relatives, the risk will actually increase of prostate cancer over time for those people. And the other thing is ethnicity. We do know that for African American men, there's a greater incidence, and for the most part, they usually have much more advanced prostate cancers with higher Gleason grades, which really tells us the aggressiveness of the cancer. For Asian people, they have a very low incidence, but when they migrate to the United States, their incidence will increase as well. There's also been some looking at some genetic factors, in particular BRCA1 and BRCA2. BRCA2 seems to be correlated also to an increased risk of prostate cancer. And I think there's a lot of other risks that we look at that, in a sense, the jury is still out. Certainly when we look at obesity, that may increase the risk. When we look at people's diet, certainly a diet that is healthier with fresh fruits and vegetables. Lycopene, which is actually cooked tomatoes, actually can help to reduce the risk of prostate cancer. But if someone has a diet that is high in fat, in particular, we know that that actually may increase the risk, because there's a theory that a lot of the hormones that are within the meat may actually kind of harbor within the testosterone and actually raise the testosterone level. And then there's some occupational hazards. I mean, one of the ones that we get very concerned about, and the Veterans Administration has really looked a lot at it, is actually the exposure to Agent Orange, which was basically a pesticide or herbicide, I guess I would call it, that was actually used a lot during the Vietnam era. So there's been an increased risk of men that were exposed to Agent Orange with other cancers, but in particular prostate cancer as well. There's also some thinking that maybe some pesticides that are used in the farming industry may also increase the risk. Probably not very modest, but it's certainly something that can happen. And then they're also looking at sexual practices. Certainly the earlier age that someone actually starts sexual intercourse, and for those that have multiple partners, they may be at a slightly increased risk, but also those that are exposed to various sexually transmitted diseases such as HPV, human papillomavirus, trichomonas, and also Guillain-Barré retrovirus.